Nope. I'll just screen.
Again, why is this one a Navy medicine one? What did I mention yesterday? It's talking about the readiness of our forces to make we are fully capable on where we're going, right? So anything that's dealing with the readiness and full capabilities, i.e. physical exams, right? Making sure that we are physically ready to go into combat or conflict.
All right, so as you should have seen up front, this is NAVMED P117, Chapter 15, Physical Examinations and Standards. My name is HM1 Evans. I'm with 2nd Med Battalion, Bravo Company. I'm one of the IDCs over at Family Med. If you haven't met me before, greetings. All right, so to kick this off, because I know I'm a little late, so we got to kind of power through this, but I'll try to answer any questions on the back end. All right, so just bear with me, take down any notes that I tell you to. All right, so purpose of medical examinations, like HM1 said, physically capable of performing assigned prospective duties without unnecessary risk to injury or harm to themselves or other service members, physically capable of performing assigned and prospective duties and not likely to incur a physical disability as a result of military service. So, can you serve specific duties, or do you have something already in place as far as a medical condition that might debilitate you in the future? All right. Conducting and recording an examination will be done by a licensed independent practitioner. Physician assistant physician assistant can perform all physical examinations unless otherwise indicated. A GMO may independently perform examinations if they have successfully completed the accredited internship. Okay? So if you have a GMO over at DERM and they've never done like deployment health or anything like that, they probably aren't going to be too savvy on doing operational suitability screenings, recruitment screenings, dive physicals, things of that nature, okay? All right, this is highlighted in red, so make sure you annotate this. All complete physical examinations will include DD 2807 TAC 1, that is your report of medical history, and DD 2808, report of medical examination. The use of the SF88 and 93 or NAVMED 6120/2 is not appropriate unless specifically required as part of a special duty evaluation. Examiners should review 2807 TAC 1, that's your bubble sheet that has all the yes or no answers, right? Just to give you guys clarification if you've never seen the form before. All right? Comments about positive responses in DD 2807 or findings on Form 2808 that do not constitute a significant diagnosis should be included solely in Block 30 of 2807 and Block 73 of the 2808. You're going to see a lot of repetition about Block 30 of the 2807 and Block 73 of the 2808. That's your final determination comments from the providers. Okay?
They like to mention the blocks on the exam if you haven't noticed already. So this is one of the weird sections where they'll dig in the weeds a little bit, talking about these specific blocks that things have to be annotated in.
Correct. And then all significant diagnoses that are found during the examination shall be annotated on Block 77 of the 2808. All right. So, if there are no conditions, no issues found during the examination or the screening, the notation NCD for not considered disqualifying should be made at the end of the description or the condition or diagnosis. Okay? So what that means is if you put a yes answer on the 2807, like let's say I had knee surgery when I was 15 years old due to a traumatic volleyball accident, right? If you've already seen ortho, you've already done physical therapy, you've already had surgery, and you still made it into the military, it's not disqualifying unless any new issues with your knee have come to surface. Does that make sense? Okay, pushing forward. All right. For a condition or diagnosis that is not deemed to be within the standards of the screening or examination that you're getting, the notation clinically disqualifying should be made at the end of the description of the condition diagnosis. So That being said, new diagnosis that is considered debilitating or something that would be high risk for you to go to the set of orders or to the platform that you're trying to go to. All right. For a condition or diagnosis that the examiner is uncertain whether it is or is not within the standards, the notation PD or potentially disqualifying should be made.
Are you on a different slide than what's presented?
I guess I am.
Is that in PowerPoint mode?
No, it's up to Google. PowerPoint.
Just drag it. So drag that all the way over to there.
All right, sorry for that, everybody. Does anybody need me to go back? Try to do this quickly.
I will say that N word is something that our minds have to trick ourselves, because usually when we see, at least for me, when I see the word letter N, I'm thinking of negative or no, or some sort of negative connotation, when it's the exact opposite in this situation. Like NCD is the best case scenario where you have something that's not disqualifying for that member.
Correct. All right. All right, if a condition deemed disqualifying by the examiner is ultimately granted a waiver, okay, from the appropriate authority, notation should be made in blocks 76 or 77 of DD 2808. So if you get a question that says a member has gotten a waiver for a condition and they need to repeat their operational suitability screening or their dive physical or something like that, they need the waiver and everything attached and that annotation in block 76 or 77 of the 2808, which is the physical examination form. Okay? All right, so there should also be the notation should include the date and the authority granting the waiver, which will usually be NAVMED, okay, or PERS. Facilities conducting physical exams will keep a copy of the exam and any supporting documents for 2 years. You always see questions about this on how long commands or clinics / MTFs have to maintain documents. It's 2 years for a physical exam.
They're not seeing the next slide.
They're not seeing it? Okay. What is going on?
Push the key here. Alright, let's just finish it presentation mode. So, here, let's see if this pulls up on the computer.
Good. Sorry, everybody, for the technical difficulties.
Alright, so I don't know if you want to teach like this.
Yeah, I'll go ahead and just have you click them. Alright, so like we iterate, facilities conducting the physical exam will keep a copy of the examination for 2 years. Let me grab this click, or let me just grab the pointer. I'm just going to use pretty top. Yeah, here, I'll click that.
Just hit the down button. Are you going to do the next slide?
Alright, go ahead, next slide. Alright, the following studies shall be recorded on all completed medical examinations. You will have current HIV, current audio, current visual, current dental, the sickle cell or G6PD screening, which should be done every time at the when you come in from boot camp, okay? For females 21 and older at the time of exam, the results of the most current pap smear, okay? And what those results were. All right, the results, in addition to any other studies deemed necessary by the examiner, will be entered on the form 2808 in appropriate blocks 45 through 52. That's going to be like your vitals, your HIV, your labs. And then 61 through 71, that's going to be like your optometry, dental, classification, things of that nature, okay? Next slide. All right, all completed physical exams recorded on the 2807, 2808 are valid for 2 years. However, some standards don't apply when they're concerned with some special duty exams. Applicants applying for affiliation with the Navy Marine Corps Reserves or enrollees in programs leading to a commission. What does that mean? If you are trying to go to BUDS, if you are trying to go DMT, or any special programs like recruiting, things of that nature, but you've had a full physical exam in the last 2 years, you are still going to be required to get a new full physical examination for that platform you're trying to go to. Okay? Next slide. All right. So what this is talking about is on the 2807, if there's any recent changes, so say you got a physical done, and then, it was said, hey, you need to take care of this, right? Then you go get it taken care of, nothing comes back clinically disqualifying, you get another appointment, the provider then attaches an addendum of the results, and then says no significant interval history since last evaluation, and then it gets approved. All right? If there is significant medical history, the item should be specifically reviewed and put in block 30 of which form? 2808. And then, 2807. Sorry, next slide. All right, common medical examinations. So routine periodic physical examinations are no longer required for active duty personnel. So all applicants for enlistment must have a completed examination conducted. Okay, everybody got a physical at MEPS when they came in. That was your enlistment physical. Okay. Recruit screening evaluations are conducted at RTC and MCRD for the purpose of detecting medical disorders that may have been missed or concealed during the recruit's initial examination. Okay. Next slide.
So real quick, just this is a good example. The questions on the test are not necessarily designed to trick you, but they may be a little bit tricky. So for example, you may see a question that says routine medical exams are required for the following personnel, and it'll say flag officers, dive officers, special warfare personnel, or none. And right there, we know routine physical examination no longer required, so the right answer is none, but the question's trying to trip you up a little bit. So like, for example, on this one, there's nothing red highlighted, no specific dates or blocks, but things like that are kind of important to remember, that we no longer do this sort of exam on a routine basis. Does that make sense?
Which was that annual certificate of physical condition is what that one's mentioning right there.
Yeah.
Because instead of routine periodic, we have our PHAs.
Correct.
Questions about that or anything I said?
Excellent. All right. So recruit screening. It's conducted within 2 weeks of reporting to recruit training. All right. It includes any lab testing, and it should be recorded on an SF600 and filled in the member's outpatient health record, which we all know that's section 2 for all SF600s.
There's an easy way to remember the 14 days. Most people in boot camp are put in P days for about 2 weeks, which is literally for that exact reason. That's why you're sitting in your dang PT uniform for 2 weeks, is till they get all that screening process done first.
For recruits with less than 180 days active service since enlistment who are discovered to have a disqualifying medical condition that existed prior to enlistment that has not materially changed since receipt of base pay, so they can pursue 2 options. They can either disqualify you for service on the spot and send you home, or they send a request up to NAVMED and MilPERS to see if you need a waiver to actually stay in service. All right, that's basically the gist of this. So you either get kicked out of boot camp, or you get evaluated and they request for you to stay in.
So I want you to pay attention to that last bullet point, because it's going to occur a lot in this instruction. Recommendations for retention are made by the Director of BUMED Qualifications and Standards. You're going to see that on multiple parts of this PowerPoint. And it's a recommendation, right? So you know how I was trying to highlight between recommendation and determination? Who makes the final determination of getting rid of service members? PERS. PERS makes that decision, right? The personnel branch, right? So they can recommend it, the Director of BUMED, but then PERS makes that final determination.
All right, so they send the request, including all pertinent medical data, Director of BUMED qualifications for standards and review. The Director, BUMED Standards of Qualifications and Standards will issue a recommendation regarding retention to the recruit training commander who will make the final determination regarding retention or separation out of the active duty service in regards to recruit training. The recruit training commander makes the final determination for recruits.
Only
Okay.
recruits.
So ViewMed will give you their recommendation. CO of RTC makes the final determination. All right, next slide. All right, reenlistment. So at a minimum, completion of Form 2807, a focus to physical examination and lab test results as indicated for any new or material changed medical conditions. I skipped over this bullet point only because it's basically saying review of the completed 2807 by the examiner, which is what is going to happen every time one of these is filled out, right? Determination by the examiner if the service member is physically qualified for active duty service. And then at the discretion of the commanding officer, IDC assigned to independent duty may conduct reenlistment evaluations. So, if there's a question that says, can an IDC commence reenlistment evaluations? The answer will probably be yes, no, yes with a designation letter from commanding officer, things of that nature. All right? That'll be one of the ones that they'll try to trip you up on by saying what provider can or cannot do a reenlistment physical. All right? So examiners should review the DD 2807, comment on all yes or comment on all yes answers from the member, or comment on any answers that they are uncertain that requires any inquiries or anything of that nature. All right? Now, positive findings on the 2807 and on 2808 do not constitute a significant diagnosis and should be solely in Block 30 of 2807 or Block 73 of 2808. See how it repeats again? All significant diagnoses shall also be listed in Block 77 of 2808. Look at that, it repeats again. Next slide. All right, U.S. Naval Academy. Applicants of the U.S. Naval Academy, the Department of Defense Medical Examination Review Board, or DoD MERB, all right, you're going to see that a lot with Naval Academy, has the exclusive responsibility for scheduling and reviewing all medical examinations. So if there was an entity question on what entity is responsible for all Naval Academy applicants for their ultimate commissioning or going to Naval Academy, U.S. Naval Academy, Department of Defense, or DoD MERB. All enrollees at the Academy who are applying for commission will adhere to one of the following procedures. All right? If a complete and current physical examination is not required for special duty screening, i.e. medical provider, dive, NSW duty, EXW duty, Marine Corps, then the following documentation should be forwarded to ViewMed qualifications and standards for review. All right? So you got original DoD MERB physical exam, 2807, review of the completed 2807 by an appropriate examiner, a focused physical examination and laboratory results as indicated for any new or material changed medical conditions, the determination of the medical examiner, results of any tests such as HIV, pap smears for females 21 and older, results of any other test deemed appropriate, and current dental evaluation. Determination of the examiner in the data above should be recorded via an SF600 entry. All enrollees at the United States Merchant Marine Academy who are applying for commission in the U.S. Navy will adhere to one of the following procedures. So it's about the exact same as the Naval Academy, but the Naval Academy is different because it goes through DoD MERB. All right. So still 2807 review and signature of the 2807 physical examination with lab results or any ancillary studies as required, and the ultimate determination of the examiner if the member is qualified for commission, and if not, if there is a waiver submitted. Okay, next slide. And again, labs, everything documented on SF 600. If a complete and physical examination is required for special duty screening, then submit the completed examination to Director, NAVMED Qualifications and Standards. Okay? So we know for Naval Academy, the sole entity for everything dealing with Naval Academy is DoD MERD. And we know for the determination or for the qualification for Merchant Marine, it's NAVMED Qualifications Standards. Next slide. All right. So programs leading to a superseding commission. All right. So as you can see, you have MECEP, Health Professions Scholarship Program, Chaplain. Basically, take a quick second to read all of these. Enrollees, programs leading to superseding commission. The Commander, Naval Recruiting Command has the exclusive responsibility to set the policies governing the commission of enrollees at the time of their graduation. So that's another one where you would say programs, who is in charge of commissioning for MECEP, who's in charge of commissioning for Medical Service Corps or nurse commissioning. Commander, Naval Recruiting Command. Next slide. All right, so for the Marines, so Commander, Marine Corps Recruiting Command for Marines, Navy recruiting, Marine recruiting. In instances when an enrollee's physical qualification for continuation in a program leading to a superseding commission is under consideration, contact the appropriate program manager or the senior medical officer at Commander Naval Recruiting Command or Director NAVMED Qualifications and Standards. Next slide. All right, separation. Get a lot of these. Separation examinations and evaluations, including members of the Navy and Marine Corps Reserve serving on active duty for 31 days consecutively. That is, so any person who's in the reserves who is active for 31 days consecutively and separating, and it shall be performed separating services within 180 days of the member's last active duty day.
This is the
last active duty day is your hard EAOS, okay? So that means if a member is coming to you like, hey, I get out in September, but I need to do my separation physical. They're about 4.5 months behind getting all their stuff annotated and everything like that, okay?
Remember, this is the only time, I know you guys have seen it so far, that 31 is mentioned. Everything else is 30 days or greater for reservists. So just know 31 is going to be associated with separation examinations. And then again, the 180 days, he mentions it for a reason. To know that, it's 180 days is usually what you'll always see with separation. It's always that requirement. It's to give enough time to get everything done so you're not falling behind the curve, especially on that VA claim towards the end.
So this is for active duty and reservists? Is it
Yes.
31 days?
So the 31 days is in reference to reservists who are on an active status, but they have to be 31 days consecutive. So you may have a reservist that they're activated and they've been on active for like 6 months. They rate a separation physical. It's just ones that just get activated who are, say, separating within the next month, but they've only been active for 14 days, less than 31. We can't do anything for them until they hit that 31 day. Okay? All right, next slide. All right, so separation evaluations we'll have at a minimum 2807. All right, the 2807 TAC 1 will have the examiner's review for any conditions that the member annotates on the form. So they will have any focused physical examinations if it's warranted with any lab results as indicated. And then the determination by the examiner if the service member is physically qualified for separation. They will complete DD Form 2697. And then all service members over the age of 35 at their effective date of separation shall be offered, not demanded, it's not required, but you can always offer a hepatitis C screening, okay? That's any service member that's separating over the age of 35. It's usually part of the separation package. Okay, go ahead, next slide. All right, take a second to read this statement. This is just something that is usually given to the service member. Okay, next slide. All right, for service members separating from service after serving 30 days or fewer consecutive days on active duty, a different separation process applies. So when they're talking about that, that's usually like your recruits, okay? Like we said, they get those P days, they get that first initial 2 weeks, find anything, something pops up, they're like, hey, is this something we need to send up to Navy Recruiting Command and everything to start considering a waiver, or are we just gonna process them out, nobody's gonna see them again after chow, kind of thing. Okay, SF 600 entry will be stating, I have evaluated the service member, reviewed available medical record entries, and found him or her physically qualified for release from active duty. For members not found qualified due to service incurred or service aggravated injury or illness, a notice of eligibility may be appropriate. Okay? For service members being separated following a finding of unfit for continued Navy service by a physical evaluation board, an SF 600 entry will be made stating what the service member has been found unfit and is being processed for separation from active duty service. Alright, next slide. Alright, retirement is the same as separation. 180 days from their hardy AOS, okay? So if they already know the date that they're going to be trying to sign their DD 214, and it's 6 months out, they should be making their appointments, they should be getting all the paperwork, getting everything ready and annotated, okay? Alright, so 2807, we know that, 2807, review, focus physical exam and laboratory test results as indicated, again, completion of the DD 2697, and offering that hepatitis C screening as indicated as well if the member wants it. Next slide. Affiliation with the Navy and Marine Corps Reserves. So, funny thing, you can't just go from active duty and jump into the reserves. You need a whole physical examination to go into the reserves because the reserves don't want you, if you're broken, coming from active duty. Okay? For all applicants to the Naval and Marine Corps Select Reserves who have been separated from Navy active duty within the previous 6 months, or were drilling reservists within the previous 6 months whose separation from active duty and or drill status was not related to a medical condition, all that's needed is a copy of a 2807, their separation physical, and VA compensation and pension history in lieu of the 2807, and then completion of a new DD 2807 by the service member wishing to go to the reserves. Alright, next. So labs, again, as indicated, member also has to bring in a copy of their DD 214 because, of course, you're a civilian now, you're applying for the reserves, so they need to know why you were separated. If no new conditions or anything, then member will be qualified. The DD 2807 and the results of the evaluation will be placed in the service member's outpatient medical record once they're considered physically qualified and they're coming in back into the reserves. And Commander, Naval Recruiting Command, or Director, NAVMED and Surgery, alright, they need to be sent any information that would preclude somebody from joining the reserves so that way they can make their recommendations. And then qualifications and standards for the Marine Corps for determination of qualification for affiliation with active reserves as well. Okay, next slide. Alright, for all applicants to the Navy Marine Corps Select Reserves who have been separated from active duty or Marine Corps active duty or active drill status for more than 2 years, who are in the individual ready reserve, a determination must be made whether these applicants are physically qualified for retention in the reserves. So that means if you got out, you haven't talked to any reserves, but you're still under that, I think it's like 8-year window after your first enlistment, you still have up to 8 years in the immediate ready reserve to where they can call you back, right? And then one day you just decide you want to go to the reserves, you still need to get a physical exam to get brought back into the reserves because you're considered in the IRR. All right, so physical examination, current statement signed by the applicant describing his or her current level of activity or any restrictions. They need a copy of their DD-214. And then, although it's a retention package, an initial screening or current physical examination will be performed. All right. If as a result of the screening, the current physical examination using affiliation standards, conditions that are considered disqualifying for affiliation are discovered, the entire package will be forwarded to Commander Navy Recruiting Command or Director of UMed Qualifications Standards for review and recommendation going forward. All right. For recommendation of risk classification or UMed physical qualification for retention in the reserves, that's for Marine Corps, will then be forwarded to Navy Personnel Command, so NAVPERS-COM, or Marine Force Reserve as appropriate for final determination regarding retention. Next slide.
So I wanted to add or to clarify what I was talking about earlier. Final medical determination will be made by those different heads that we went over. But if it's dealing with the actual retention in service, that's where it goes through PERS. So even on those other ones where they're making that final medical determination, they still then have to go through PERS to actually separate that member from service, if that makes sense. That's why this slide is different with talking about retention on that last line.
If a medical department representative determines that a reservist has developed or had a material change in a medical condition that will likely prevent the service member from safely or effectively fulfilling the responsibilities of their rank or rating, the member should be classified temporarily not physically qualified as appropriate. The following documentation will be assembled. All available medical information, including copies of the outpatient medical record, 3 previous years of preventive health assessments, commanding officer's statement regarding any limitations, any DD 2807 or 2808 within the last 3 years. So now they're going back 3 years, okay? So if you're determined that you are probably not going to be qualified for the service, they have to pull 3 years back to see if you are really worth retaining. All right. Next slide, please. All right. Navy and Marine Corps Reserve, they shall complete PHAs annually. All right. You guys understand, like when you see instructions that say shall or will or something like that, that is a requirement. Okay. If it's like should or are recommended, like they can do it up to a minimum or maximum usually, right? Medical department representatives are encouraged to obtain additional information from reservists via outpatient medical records or other sources appropriate to develop a complete understanding as possible for the conditions. If an MDR determines that a reservist has developed or had a material change in a medical condition that will likely prevent the service member from safely or effectively fulfilling the responsibilities of the rank or rating or interfere with mobilization. Next slide. So that was probably one whole sentence, but made into a next bullet. They will be put temporarily not physically qualified as appropriate. Last 3 PHAs, all their health records, CO statement regarding limitations of the reservists, last 3 2807s, 2808s. All right, and then after recommendation is made for retention, Director, UMed Qualifications and Standards will forward to PERS, or Marine Corps Personnel Command. Next slide. All right, so if there is a question that says you are working on a service member's retention and everything like that, how long can you hold on to their physical? All right, MDRs may delay submission of a retention package until sufficient medical information is available. However, At no time will you go past 180 days. If an MDR determines that a medical condition will not prevent the service member from safely and effectively fulfilling the responsibilities of their rank, then it should be documented, put on an SF-600, and entered into the reservist outpatient medical record, and also annotated on the DD 2766, which is their chronological record of care. That's what you're supposed to annotate on the paper forms every time you do their PHA or any time a physical is done. That's usually like their running thing of showing that they've had physicals or PHAs. All right, next slide.
Sorry, what this red sentence means, just to be completely clear, is once you start working on somebody, but they have a bunch of extra stuff they gotta get taken care of, so you don't get it all done in one day. If they come back to 180 day 181, and that previous package wasn't completed at day 180, you gotta start all over again from scratch. That's what that line means.
And also, just for everybody's clarification, we all know that the physicals are good for 2 years, right? Most induction physicals, if you go anywhere, you'll find this out. Most induction physicals are only good for 6 months, okay? That means that it follows this parameter of the program itself to make sure that we're not holding on to anything for final determination past 180 days, okay? All right, next slide. All right, so this is our guidance. You have NAVMED COM Instruction 6320.3. That's for civilian examinations. For deserters being detained by naval placing confinement, review SecNav Instructions 1640.9. And then for deserters being processed for separation, evaluations will include a 2807, review by the examiner, determination by the examiner if the service member is qualified for separation, and the completion of the 2697.
So just kind of make it make sense again with what I was talking about yesterday, right? Why do you think that detainee one is a SecNav for first off? It's dealing with national security, right? A nuclear security measure. Why do you think it's a 1000? What's it talking about specifically within that? Personnel, right? So simply knowing what that subject's talking about and who it's talking about tells you already what the SSIC and that beginning part of nomenclature is going to be for that instruction.
All right, uncorrect, so things that would just be disqualifying, all right? Uncorrected deformities of the skull, face, mandible to a degree that would prevent the individual from properly wearing a protective mask or headgear. Loss or absence of bony substance of the skull. Current blepharitis, current blepharospasm, deformity of the lids sufficient to interfere with vision, current growths or tumors of the eyelid. Now, to be clear, these are things to keep you from joining the military, okay? If you incur these things while you're active duty, then you get treatment and we see if you can actually be retained. All right, next slide.
Does that make sense to y'all? So like you can come in with, you can't come in with a missing testicle into the service, right? But say you have both and you lose one while you're in, they can't kick you out because it's not disqualifying because you already signed a contract and they accepted you in service.
Yes.
Now, depending on if you can still physically perform and do what you need to do, that'll be made determined. I say that because you'll be like, but this person has this. Why are they still in? It's because of that reason.
Correct. All right. Chronic conjunctivitis, corneal dystrophy, retinal defects, so anything with the eyes, anything going on with the external ear, congenital or required stenosis of the ear, chronic otitis externa, so if you get swimmer's ear a lot, that would basically inhibit you from putting any kind of hearing protection in, or if it would cause you the need for like tubes in your ear because your ear doesn't drain properly. History of mastoiditis, chronic otitis media, a cleft lip or palate defects not satisfactorily repaired, so you could end up having that and be denied military service. Chronic conditions of the larynx, so if you constantly get like strep throat, things of that nature, or you need surgery because you have like a tumor in your neck or something, that might disqualify you.
So,
Next slide, please.
so there's two common subjects about these that can help you remember all of them, right? Keyword is chronic. If you see chronic by a lot of these, and it's long term, a lot of times they're not going to accept it for you. The other one is cannot be fixed, like by surgery or anything else. So if some sort of deformity can't be fixed, a lot of times those are the two types of symptoms that they have that they're not going to allow you into the service.
All right. So now we have abnormal elevation of the diaphragm, absence of lung or mediastinum, coronary heart disease, basically a whole bunch of cardiac issues, major abnormalities of defects of the genitalia, such as change of sex. So again, not saying, we all know now that if you're in the military and you decide to go to transition, the military will consider helping you out with that. But if you are like in the process or anything as you're trying to come in, you're considered a high risk, and the military might not allow you because of all the medications and everything like that that you would have to do while you're currently at RTC or something of that nature. All right, history of penis amputation, absence of one kidney, current deviation or curvature of the spine, so scoliosis, okay? So if you guys don't know, make sure you put these degrees down in the back of your head, all right? So lumbar scoliosis, that is greater than 20 degrees, lumbar, thoracic scoliosis, greater than 30, or kyphosis or lordosis, greater than 55 degrees when measured, okay? Don't necessarily need to know the Cobb method. They're probably only going to ask you the degrees if you get a question like that on the test, okay? All right, next slide. Yep, if you fractured your spine or anything like that, you probably shouldn't carry a pack. We all know that. Limitation of motion of joint ranges, so if you can't bring your arms up, if you can't hold them out with weight or anything, if you can't hold something like this when your elbows flex, and you can't extend, or you extend and it's past 15 degrees, and then any wrist issues that cause any limitations in range of motion from there for 45, and inability to clench fist, pick up pin, grasp an object, or touch tips of at least 3 fingers to your thumb due to like nerve issues or anything from prior surgeries, that's disqualifying as well.
So these have been on the test, but the easiest way to help you guys think of it, and it's going to sound dumb, just if I'm in the test, I'm going to be moving some body parts certain ways and be like, well, that doesn't make sense. If it's 15 degrees, I still should be able to do with what it is. But if I can't turn it all the way, then I know that's going to be the condition that's going to cause me to not be able to come into service. So you might have to just literally sit in the chair during the test and turn your body parts certain ways just to figure out what that degree is going to be there.
Yep. Next slide. Absence of the distal phalanx of either thumb. Your distal phalanx is the tip of your thumb, so if you have a nub thumb, okay. Hip flexion of less than 90 degrees, extension 10 degrees, abduction 45 degrees, rotation 60, knee extension 0 degrees, knee flexion 110 degrees, ankle dorsiflexion 10 degrees, plantar flexion 30 degrees, subtalar inversion and inversion totaling 5 degrees. So this is saying, for all the degrees, they're saying if you cannot meet that degree, we all know, like my hip, our hip flexed, right? I can go past 90 degrees. But if I can't bring it straight out, at least to 90, that is disqualifying. All right, next. Cardiovascular disease, we already kind of went through that. Anemia, diabetes, it's disqualifying. Next. All right. So you have to sum this up, you have aeromedical examinations for flight crew, pilots, things of that nature, people who are associated with flight crew, people who are in the birds, what have you. All right, there are 4 flying classes. Make sure you annotate that. There are 4 flying classes. Those types of physicals are going to coincide with that level of aviation personnel. Okay? If you look in the chapter 15, I believe it actually even goes over which class or what level is for each type of personnel. So if you get a test question, what level of flight physical do I need for a air crewman? It'll be who is actually attached in the bird. It'll be like a class 3 or something like that. Okay? Does that make sense? All right. So you'll have a 2807 and a 2808. They also must submit an SF507. All right, results of this examination must be entered on NAVMED 6410/10. All right, that is their short form. Next slide. All right, all new aviation check-ins will probably have a flight physical done, or they'll have an SF600 with their most recent physical annotated. They'll also have the annotations PQ or MPQ or waiver, all right, with the waiver status. All right, you'll also make sure that their flight physicals are annotated on the 2766. This is always on the always on the exam. Okay, this is at the back of section 3, right over your chronological duty assignment list. Okay, inside the medical record of section 3. This is their running annotations of when they got their flight physicals done and what those determinations of the flight physicals or NSW physicals, dive physicals were. All right.
So again, don't get it confused. The results of examination for the air medical are going in the 6410/10. The medical recommendation for flying is going to be your DD form 2992.
For everybody that doesn't know what a 2992 is, it's your up or down shit. Okay, if you've been with aviation, you understand what an up or down shit is. If you think about it, DD form 29, so it's going up, 92, down. So it's your up and down shit. All right? All right, next slide.
That's 60 days. Make sure you highlight too. I know it wasn't highlighted on the last slide.
All right, divers. Diving duty. Must be free of distracting musculoskeletal conditions, heat conditions, or confounding neurological symptoms or behavior instability. I.e., if you have sinus issues, you can't clear for going to depth. All right. If you have severe migraines, you probably shouldn't go dive either because you'll get mask squeeze and you'll cause yourself a migraine and you'll go unconscious. All right. So within 2 years of application of initial training, and then between examinations will not exceed 5 years up to the age of 50. After 50, it is back to every 2 years. So what does that mean? It means if I'm going to try and get into dive duty, I have to have an exam before 2 years before initial training. After that exam date is completed and annotated in my record, I then am required, after completing all my dive stuff and getting certified, to do it every 5 years. Okay? Until I'm at the age of 50, then I'm considered a high risk because most 50-year-olds in the dive community or anything don't dive anymore, so they have to do it every 2 years. All right? And then at 60, the examination is required annually. Those are going to be more so like your COs, Commodores, flag officers of that nature. All right? And then screening questionnaire, prior to actual training. All right. All applicants of dive training must have a valid 1200/6, and that is the screening questionnaire signed by a UMO. Next slide. All right. The requirements for the physical. All right. They have to have a chest X-ray, EKG, audio within the last 12 months, dental, type 2 or above in the last 12 months. They need a TB, latent TB screening or TB questionnaire. All right. They They need special vision tests, so usually on that exam, you'll send them to optometry, where they'll get pressure tests. All right, and then if they're older, and then they'll also get a color vision test. All right, they'll also get some labs, as you can see. You got your CBC, UA, glucose, Hep C screening, and then blood type, G6PD sickle cell, but that should already be in their MERS account if you look that up. Okay. And then all designated divers must be immunized both in Hep A and Hep B, or if you've come in the last 10, 15 years, twin race, okay?
Your color vision testing, I know it's in this instruction, it was on the PowerPoint, is your Farnsworth lantern test. Easy way to think about that is lantern and light. So lantern and light I associate with color. Is there something different? What's the other test?
You don't have them anymore.
Well,
The lantern test, they don't manufacture them anymore, so it's just the Ishihara, but for the test purposes, go with that.
yes.
Yeah.
So test purposes, Farnsworth lantern. So the easy way to remember, as I was saying, lantern is a light, and I associate light with color. So color testing is Farnsworth lantern.
Special operations, duty medical screening, it mirrors dive screening, submariner duty, except for the 6420 slant 2. For female submariners and submarine candidates, as well as most recent pap smear and breast cancer screening. Why? Because on submarine duty, they could be doing nuclear stuff, so they need more radiology testing and things of that nature. Next slide. All right. Explosive handler, explosive vehicle operator. All right. Special duties certification examinations are required for active duty and civilian personnel. All right, so your civilian personnel on your base also need these if they're handling any types of explosives, ordnance, or transporting such. All right, so required every 2 years. Explosive handlers every 5 years. So vehicle operator 2 years, 10 and 2. And then for explosive handlers, I'm handling it with my hands, 5 years. Okay? Next slide.
I did notice too, just because I know it's going to mix you up, I added the 6410 and the 6420. Mentioned there's forms. I don't want you to mix up the two. So when it's talking about 6410, it's aviation. 6420 is talking about subs.
All right. All patients should be screened annually for obesity and BMI calculation. We do that before the PFA. Chlamydia screening, and women aged 25 years and younger and other asymptomatic women at risk of infection should be screened. Cervical cancer screenings or pap smears. Each patient should be evaluated at her annual examination to see if she is due for cervical cancer screening. This is where you go for any updated guidelines.
It's kept vague because these guidelines change a lot.